We know the signs of heart attack, the pain in the chest and the arm, but what is a foot attack? Well, that's when arteries in the lower limbs get clogged with plaque, preventing blood flow and oxygen from reaching the lower leg and foot. Now, it is caused by peripheral artery disease, or what we also call PAD. So we have Dr. Sahil Parikh here of Columbia University Irving Medical Center and Dr. Jennifer Jones-McMeans, Divisional Vice President of Global Clinical Affairs at Abbott's Vascular Business, both joining us to explain what PAD is and discuss Abbott's first of its kind dissolvable stent called Esprit BTK system, designed to help the most severe forms of PAD. Both, thank you so much for coming on the show today, guys.
Thank you.
Thank you.
No problem. So first, Dr. Parikh, tell us a little bit more about peripheral artery disease and how prevalent it is.
Yeah, peripheral artery disease, or PAD, is the most common disease you've never heard of. It affects about 1 in 10 Americans, or about 40 million Americans. And as you pointed out, it's really the blockage of the blood flow to the legs. The plaque that blocks the arteries is the same kind of plaque that develops in the heart that can cause a heart attack, or in the brain that can cause a stroke. And so patients who develop PAD are at risk for a leg attack. If you were to think about the symptoms, typically patients who have plaque in their arteries in their legs will gradually develop pain or cramping in their legs when they're walking, or just feel like they're having difficulty walking. Eventually, that can get so bad that they can have pain at rest when they're just sitting there, or they can develop wounds from insufficient blood flow. And when that happens, people are really at high risk for developing amputation. So it's a very serious problem.
Very interesting. So what are the symptoms and how dangerous is this?
Yeah, so again, if you develop plaque in the arteries anywhere in your body, you're at risk to having it everywhere in your body. And so patients who have PAD are at very high risk for developing complications like amputation, but they can also develop plaque complications in their heart that can cause heart attack, or in their brain that can cause stroke. So the treatments are really focused on medications and exercise and lifestyle treatments. And then when the blockages in the legs are bad enough, we have ways to open those blockages so that we can restore the circulation and prevent amputation.
I want to talk about Abbott's new dissolvable stent with you, Dr. Jones-McMeans. Why does this matter for people living with PAD right now?
Yes, Abbott's proud of this landmark moment where the Esprit BTK is now available and approved by the Food and Drug Administration to be used as a treatment for this severe form of peripheral artery disease. Dr. Parikh talked about some of the treatments available to open up these blockages, and one of them is a standard of care called balloon angioplasty. But part of the problem with balloon angioplasty is that once it pushes the plaque aside, the artery is going to pretty much close up again. And so the patient's going to have to come back for retreatment. Whereas Esprit, when it's delivered, the plaque is pushed aside, but it also has a drug. And this drug is very important because it's going to prevent the artery from closing up again. And the scaffold itself does support the artery for a period of time, but then it dissolves and goes away, which is also an important attribute because it allows for treatment options if physicians need to come back and retreat areas around what was treated prior.
Yeah, very interesting facts here, guys. Where can our viewers get more information?
If interested, viewers can go to abbott.com or pad.info.com.
Thanks for watching. Stick around by subscribing today and don't miss a single video.